Dr. Ed Zimmerman, welcoming you to another segment in Aesthetic Revolution, the podcast. I'll be your host along with my hostess, Staci Zimmerman. And today we're going to be talking about something kind of bulging, prominent, an issue, things that people come to us, and it's all about lumps and bumps below the belt and from here to eternity. They happen everywhere from forehead to feet. But particularly below the belt, lumps and bumps can be problematic because people think, is it an STD or an STI, a sexually transmitted issue, whatever that may be. But there are a lot of benign lumps and bumps that happen below the belt, as well as all over the body, that we treat in our 5,300 square foot of fun at Aesthetic Revolution. And we do a lot of these with traditional medicine, cold steel, as it were, but we also use CO2 laser and other modalities. In fact, we have a fully accredited operating room for some of those bigger lumps and bumps. But let's talk about the lumps and bumps and the variety of things that come in that are pretty benign and pretty uninteresting.
Some of the biggest ones are, we've seen like fatty lipomas on people's shoulders, or I'm just thinking most recently what we've seen. But I feel like those are more common. You see a lot of those, and they can be anywhere on the body.
Yep. So a lipoma is fat that's been encased in a balloon-like shell, and you want to get that shell out, or you can have scar tissue that just allows additional adipocytes, fat cells, to form. They often happen at a site of trauma. So you see them not infrequently in people on the inner arms, the sides of the chest, any place they might be carrying books or a backpack or groceries or any number of things that happen during normal life. Well, they happen down below as well because the trauma of having relations or other things, just, sports activities, things like that. And there'll be a little area that gets traumatized, some scar tissue will form, and the fat inside that scar tissue becomes like a little island, and it grows with a mind of its own. And eventually you can feel a little mobile pea. It's not a lymph node. It moves around. It doesn't hurt. It doesn't get bigger or smaller when you have an infection. It's generally in the fat layer, and you can see them just under the surface of the skin. And people come in and go, I don't know what it is. It wasn't there before. And we're able to do an ultrasound on it. We can do the ultrasound in the office, and we can see that fat looks like fat. So the lipoma is just encased fat, maybe a little bit different density on the ultrasound, surrounded by a little envelope or balloon surrounded by fat. It's usually not attached to anything unless it's a wildly traumatic lipoma. And the treatment can be anything from do nothing. Over the years, we've tried injecting it with a medicine that causes fat cells to dissolve. That seemed to cause more scar tissue and was less dependable, and took a number of treatments before we were able to get that to dissolve. So we don't do that anymore. You can go in with cold steel, so you can numb things up using a little bit of local anesthetic like the dentist would use. Very carefully trap the lipoma between your finger and your thumb, make a little incision over it along the lines of tension, hopefully, and then pop them out just like a little zitster. And then repair the skin. The fat will fill in from the sides. You've taken out the lipoma and the little balloon around it. And then you can do a subcutaneous or cutaneous closure with pick your suture. Everybody has a favorite of how they like to do that. In our office, I find that using a CO2 laser gives me a nearly bloodless field and a lot more precision. So with cold steel, you can kind of feel your way down to the lipoma, but sometimes you go through the covering, and some lipomas are loculated, so they have little individual spheres all kind of attached together. The CO2 laser lets me explore that a little more carefully, often have a smaller incision, and I think have a little more precise healing. So it can be a little nicer, and it's quick. And CO2 laser is a laser whose energy is absorbed by water or anything that contains water. So there's water in the skin, in the dermis, in the tissue, even through the fat, there's hydration. And so we're able to very carefully dissect in a nearly bloodless field that closes the little capillaries and closes the little nerve endings. So it tends to have a little less bruising. than cold steel. But when in doubt, a 15 or a 10 blade will take care of things and allow you to get down to the lipoma, milk it out like a little watermelon seed or jelly bean or whatever. And these things can be quite large. I've taken out lipomas, the size of a hand or two that have been around quite a while. And then we have to do a little clever surgical revision to pull the tissues adjacent to it together to close the dead space, as it's called, and then close the tissue in a couple layers so that it leaves the nicest visible incision line. Mm-hmm. So those are lipomas, and those are certainly something that we see below the belt in men and women for whatever reason. Now, sometimes people will come in with a bulge in the inguinal area. That's the fold between the top of the thigh and the bottom of the belly, or the suprapubic area. And that bulge may be a hernia. And that's not an in-the-office fix. That's a go to your general surgeon fix. If you've got a bulge there that you notice, particularly when you're lifting or coughing or bearing down or in certain positions, that is a weakness in what contains the intestines and the fat that goes around the intestines. There's a little curtaining of fat there that should be there. Sometimes there's a weakness down there because you have to have a way for things to transit out from inside the abdomen all the way down into the scrotum, for instance. So you've got the inguinal canal, the spermatic cord, and blood vessels and nerves and such go through it. And there can be a weakness there where some things try to sneak out. That's a surgeon purview, the general surgeon purview. So that can be an indirect hernia, or a direct hernia is just a weakness on the outside, or a femoral hernia. All those kinds of hernias are not an in-the-office repair. Particularly if they're causing you some issues, tissues getting pinched, or it's uncomfortable. So we see a lot of very simple things like skin tags. Anytime that you have an area where tissue rubs back and forth against each other. So whether it's a neck with necklaces, or a collared shirt, or under the arms as arms go back and forth, or thighs as thighs scrape back and forth, or in the genital area, we can have skin tags, little skin appendages where there was a fine hair or a thicker hair, something got snagged, and the skin gradually tenses around it, gets longer and longer until you've got this little dangling thing out in the air, and it gets in the way. It catches on whatever's going by it. And, certainly there are people at home who take a string and tie it around the base, and they get part of it. Or a pair of nail clippers. It would be nice if they sterilized them and cut them off, and then they bleed like stink sometimes. Or you can come to the office, and that's something that, again, we can put some topical or injectable anesthetic into the base of, and very carefully snip it off, either with cold steel or the laser. And again, it's quick, and we can do dozens and dozens of them at a time.
I will say that seems to be something that is on the rise for whatever reason. We're seeing more and more of this in women and in men, and really simple to have them come in real quick and buzz those off with the CO2 laser, and they're gone.
Or even electricity, bifurcation, radio frequency. There's a lot of ways to do that.
Right. Well, the way we normally do it is with the CO2 laser. I will say that I've heard that some of those home remedies of tying a string around it doesn't always, we might get part of it off, but it seems to come back. That's what we tend to hear.
Yep.
But when they're buzzed off, they're good and gone.
Yeah, and be careful with the chemical remedies, because you rarely get a caustic chemical on just the tag. You tend to get it on the tissue around the base of the tag. It can cause pigmentary issues. It can cause the tag just to get ticked off, but grow more. So, those are not ones that I recommend as far as the over-the-counter remedies. But yeah, I think especially with the amount of obesity, of heaviness, that we're seeing more tissue rub against each other. And then as people lose the weight and the skin is hanging, before they come to us and they resect the skin or use some energy device to shrink wrap the skin tight against the new shape, the new form, we see skin tags from that too. So, we see them a lot, particularly under the arms, under the boobs, and down below. So skin tags or ephilids are, something that are pretty easy to take care of. Mm-hmm. We also see benign lesions. So there are lesions that look like a stuck-on barnacle of life, like a little bit of gum or toothpaste or something has been stuck on the skin. And people may notice that they itch a little bit, they itch them away wherever they may be, and then they come back. And they never quite go away, but they don't have a lot of flakiness, they don't hurt, they don't bleed a lot or anything like that. So that may just be a seborrheic keratosis, so a benign barnacle of life. And again, we use the CO2 laser to take care of those in all skin types. Doesn't matter whether it's lighter or darker skin. It can leave a pigmentary change, but it's probably better to have something that's smooth and even instead of a piece of chewing gum stuck onto wherever it is, whatever it looks like. That responds really well to CO2 laser as well. So that one's kind of fun to do and pretty quick and easy. It doesn't require an excision that we have to go digging around and then close in multiple layers. Mm-hmm. So, there certainly are some lesions that do.
Let's talk about real quick, precancerous lesions or cancerous lesions that we see. Sometimes we're the first ones to see it. People don't think, they're coming to us to have, pigmentation, IPL or something like that. And then we notice a lesion that they didn't realize was an issue. So let's talk a little bit and share how to spot those cancerous lesions.
We have an ever increasing number of skin cancers that are being found. Maybe because we're looking harder now, maybe because we have digital imaging that allows you to compare a picture now to one you had 5 years ago. Concerning skin issues, if you look at the alphabet soup, we have a mnemonic, the ABCDs and a few others. So A is for asymmetric. If you have a lesion that is new on the tissue and you couldn't in your mind take it and fold it over on itself and have it be pretty even, that may be a little bit concerning. So asymmetry. B is for bleeding. If you have a new lesion that bleeds unexpectedly and continues to bleed, it doesn't stop easily. So everybody gets a scratch now and then. You just hold a little pressure on it for a minute and it stops bleeding, unless you're on anticoagulants or a lot of fish oil, ginkgo, garlic, ginger, whatever it is that's keeping your platelets from clumping together. But bleeding would be, and a new skin lesion would be a concern. C is for multiple colors. Now, concerning lesions don't have to be multiple colors, but melanomas and others are described as red, white, and blue, but they can be flesh color, and flesh color. So, but certainly multiple colors, multiple shades of brown, depending on the thickness of the lesion. Where it's thicker, it may be a darker brown, and where the edges, it may be more of a tan. That may not be as concerning, but it may be a reason to see your dermatologist. A, B, C, D, diameter greater than the head of a pencil, eraser of a pencil, which is about 6 millimeters around. So diameter greater than 6 millimeters. E is for elevation. If something that was flat becomes elevated and you really notice it. Now, benign lesions elevate, so seborrheic keratoses elevate. And, particularly you'll notice them up in the scalp, or you're combing or brushing your hair, your hairstylist or barber will notice, and they'll bring it to your attention. And we're able to fix those. And it doesn't kill the hairs where the lesion is removed, by the way. So asymmetry, bleeding, multiple colors, diameter greater than 6 millimeters. E is for elevation. And I added a couple letters onto the ones that were taught in medical school. F is for feels funny. So if it feels funny, if you have a lesion that now is itchy or hurts, or you're just more aware of for some reason, that's a reason to kick up an eyebrow and go, is this something to worry about? And G is for grows rapidly. So if something wasn't there and now it is, and it's not something that just goes away again, those are all reasons to consult your primary care doc or your dermatologist to take a look at it under magnification, review your history, see if you've had extensive solar exposure. So it's not just something that everybody has, or you have a strong family history or a history in you of a squamous cell carcinoma, a basal cell carcinoma, a melanoma, some sort of skin cancer. Those are all worrisome things. And skin's the largest organ of the body. It's easy enough to see where these things are for most people, but some people don't see the places they don't see. So they don't see the top of their head, the back of their neck, their back, their tush, those areas. And the skin lesions can spring up. and they may have been growing for years before they ever get noticed. So you can get those things checked out. And your dermatologist may or may not be concerned about something. They may do something called cryotherapy, where they spray it with liquid nitrogen, and that'll take care of the superficial cells. And then if it comes back, they may biopsy it and send it out for look-see under a microscope by a dermatopathologist, and they have certain stains and things that they look for to see whether it's normal skin or whether there's a pathologic change there that needs to be more broadly excised or treated.
The other thing we see too is like patches of like dry skin that never heal. They keep drying over. Those should be looked at too.
Yeah. Those areas of dry skin, not so much eczema, but dry skin that also flakes and has little pinpoint bleeding, little petechiae, that may be an early solar keratosis that can become a squamous cell carcinoma over time.
And they're finding that skin cancers are being found in younger patients now than ever before. Don't know why that is. I mean, obviously, long-term sun for us older people, it's common, but they're seeing younger and younger patients with skin cancer. So
sure, and whether it's we're looking more or whether we've had more exposure in our environment, the foods we eat, the water we drink, what's around us in the air, whether younger people have more exposure to carcinogens, either way, check your skin out.
Right.
Have someone you love check out the areas you can't see, or at least trust.
You're never too old to.
You're never too old or too young. You know, even kids can have skin cancers or skin issues. So that may be why we're seeing them in younger people. And you know, I think the pendulum has changed in terms of how we protect our skin now from sun. So we're seeing other issues. But certainly there are a number of benign pigmented lesions. You can have a regular old mole, you know, a compound or junctional nevus, a pigmented area that jumps up just as a part of getting older. And that may be a concern. It may or may not be an issue we need to treat. You can have an ingrown hair, certainly in the pubic region where it stays warm and moist. And bacteria likes to grow no matter how good your hygiene is, or with people shaving or epilating down there. You know, ingrown hairs are not infrequent in that area. They can be treated. If you can't treat it, then, you know, we need to unroof it, allow the inflammation, the pus and stuff to get out. Maybe consider laser hair removal if you have darker hair on a lighter background skin that won't absorb the energy, because the target with laser hair removal is the pigment in the hairs. And if you're older and your hairs don't have pigment, it's too late for lasers, but it's not always as much of an issue. We see modestly pathologic issues down below. So warts are an issue, and a wart on a penis or a vulva looks different than the wart you may have on your finger or your nose. So because it's, again, an area that's chronically macerated, moist, and so it looks a little bit different. But these should probably be treated because there's an increased incidence of cervical cancer in women who are exposed to certain HPV, wart viruses, from male or female. So, you know, these are not totally benign and they should be treated. Lots of ways of treating them, generally covered under your insurance. Laser, I think, has the highest kill rate at about 85%, but other ways, including liquid nitrogen and chemical compounds that acids and things like that, not the most comfortable, can kill warts. You can't just necessarily cut them off or vaporize them off because the wart virus tends to live within about an inch around the wart itself. So when you're destroying a wart, you're actually not only taking away the bulk of the tissue that contains the wart virus, but you're also hopefully sensitizing the body to that particular virus, causing your immune system to kick in and go after that particular virus. But there's thousands of wart viruses. So, you know, you may be prone to another wart when the time comes. And warts can happen no matter your cleanliness. It's just if there's a little excoriation from relations, shaving, wearing clothes, whatever, and the wart virus is in the air and it gets through the little opening and starts to cause the skin cells to grow rapidly. That's basically what a wart is, and push things out of the way. Well, then there's a wart. There are normal skin appendages, and we've talked about penile pearly papules. So when you pull the foreskin back, or if the foreskin has been removed, you can see around the corona, the edge of the glans penis, little filiform-like structures that some people have, not everybody has. These are benign. They look like filiform warts, but they're actually a normal appendage, and they don't cause any harm. They don't necessarily add a lot of sensation during relations, but they do scare people, either the people that have them or the people that may see them prior to relations. So they can be removed very carefully. Again, generally with CO2 laser, a little bit of local anesthetic. Healing time is about a week, 10 days, and then everything is perfectly smooth and nice and glistening mucosal tissue like you would normally have on the transition from the skin of the shaft of the penis up to the corona of the glands.
Are those, can you feel those, or are they flat?
You can actually feel these little tiny finger-like or bubble-like spikes all along the edge under the corona of the penis there. It looks like a little miniature lion's mane, but very short.
Can women get that same type of?
Good question. Women get an analogous set of issues, so they can have little appendages along the inner aspect of the labia. Or if you pull back the hood of the clitoris, there can sometimes be some little filiform lesions there. Most people don't notice them, and we don't make a big discussion of them. So now women can have other issues where the secretory glands, like the Bartholin glands, become blocked. And sometimes when a gland becomes blocked, it has to be incised and drained, or incised and allowed to drain, and then heal up again. It's not something that necessarily repeats itself, but that can be an issue more for gals because they have more lubricating glands in the birth canal and around the labia than guys do. Okay. But lots of benign lesions that happen down there. Remember, at the base of every hair follicle is a gland that lubricates that hair. So if the gland gets backed up, you can have a little pimple, a little pustule down there. You can have a blind zit that hurts. And you can have in the thinner skin that some people will notice on the labia or on the scrotum in particular, that base of the hair follicle gland, that pilosebaceous unit, you can feel it. You can feel a little half BB-sized bump there. That's not pathologic. That's normal. And you just happen to be able to feel that because of the thinness of the tissue and your ability to kind of feel on both sides of it. Okay? What are we leaving out as far as lumps and bumps?
I feel like those are the major ones, the ones we see the most often.
So we've talked about lipomas. They're the bigger, bulgier, balloon-like ones. We've talked about skin tags and warts. We've mentioned hernias. We've talked about backed up glands and ingrown hairs and stuff like that.
I think that covers a lot of them.
Okay, so I think we've basically covered lumps and bumps. And, that's below the belt, but these same issues happen everywhere from forehead to feet. So if you have an issue, come see us or get to your doctor. And thanks for listening to another episode of Aesthetic Revolution, the podcast. Like, look, listen, share, ask questions. I'm Dr. Ed Zimmerman and Staci Taylor, your hosts, and we'll look forward to seeing you next time on another segment of Aesthetic Revolution, the podcast.